My name is Cedric Manlhiot. I'm a research scientist at Johns Hopkins University and the director of the Cardiovascular Analytical Intelligence Initiative, or CVAI Square. I study health data. Every time a patient enters a hospital or sees a doctor, it creates data. Now, that data is usually stored in electronic medical record to track the patient over time, but not much else is being done with that. And there's a lot of untapped potential here. My work is to develop tools that use this data to help doctor better treat patients. First, we have to design solutions to better collect and store health data. Health data is currently stored in a way that is very difficult to access. Sometimes we can't get to that data, sometimes some data is missing, and sometimes it's in a format that we can't readily use. If you think of health data as a book, it's like a situation where some pages are missing, some chapters are written in invisible ink, and some sentences are just written in a different language. Our work, the first part of our work, is really to develop these tools that would make the book better organized and easier for us to read. Well, the second step is for my team to start looking at the data and search for useful pattern in that data. A useful pattern in data is something that we can mathematically express and then convert into a useful tool for clinician. For example, predict the risk of an outcome or of a diagnosis. To do this, we use statistical methods, and when we are dealing with very complex data, we use a method called machine learning, which is a branch of artificial intelligence. For example, in one of our NIH-funded studies, we are creating tools to better diagnose, treat, and manage children who develop multisystem inflammatory syndrome in children, which is a rare but severe complication of COVID infections. With these tools in hands, doctors will have a better sense of which therapy are most likely to be successful in a given patient, or how likely some complications will be. They can use this to tailor therapy for each patient according to that information, or to take preventative measures to prevent complications that are very likely in the immediate future. Finally, the last step for us is to create computer programs that will allow those tools to be deployed at the bedside so that they can be used in real-life clinical situations. We also create programs that monitor how our tools are used by physicians and other healthcare providers and monitor how they impact patient outcome. In the end, we want to make sure that our work is useful and positively impact patient outcome. In high school, I once went back to my parents and complained that I would never use anything that I'm learning in AP mathematics. So it took quite a few twists and turns for me to lead a research program where I interact with numbers every day. But through the years, I learned how mathematics can be used to organize data and derive useful insights from it. It is challenging, like solving a puzzle without having a picture of the end product, but it's fascinating. And in medicine, it can also produce something that might be beneficial for patients. Over time, we noticed that even though we were creating a lot of very useful products using health data, many of them could not reach the patients or the doctors. And this was for a variety of reasons. So when we created the CVAI Square, our current research program, we decided to focus on the entire life cycle of health data and data-related product. Children with heart disease represent a unique challenge in terms of health data, mostly because every patient is unique and they have very complex pathologies. Many of the methods we typically use to generate insights from health data can't be used in children with heart disease because they are so uniquely complex and each one is different from the other. That means that we have to constantly redevelop new methods and push the technological frontier so that those typical methods can be applied to this very special population.